Malignant melanoma is a malign tumor of melanocytes which exists in dermis. Once it was considered relatively uncommon, but now it's known that its incidence is increasing during the past few decades. Surgery is the definitive treatment modality for the early stage melanoma, most dangerous form of skin cancer. It may arise from existing mole or occurs spontaneously. Those are brown but at the same time may be blue or white in color. The melanoma occurs usually following intense sun exposure, usually sunburn, especially in those who are genetically predisposed to melanoma. If it is recognized and treated early, it's curable, but if it's late, usually spreads distantly and fatal. Moles, brown spots, and growths on skin are usually harmless but not always. Anyone who has more than 100 moles is at greater risk for melanoma. The first signs can appear in one or more typical moles. That's why it's so important to get to know your skin very well and to recognize any changes in the moles on your body. You should look for the ABCDE signs of melanoma. If you see one or more of these, make an appointment with a physician immediately. A means asymmetry, B means border irregularity, C means changes in color, D means diameter, which if it is more than 6 mm, then should be considered dangerous. And finally, E means any change in mole, also means elevation. Then if someone notices one of these changes in his existing mole, you should see your doctor. The principal treatment is surgery. The surgery may be complicated and long-lasting way. It is not always simple. At the same time, the patient should be aware of that he may undergo a couple of necessary operations. Then different treatment modalities may be necessary and will be used. The pathology report is especially important and should be detailed because all treatment choices will be arranged according to that report. The prognosis is dependent on tumor thickness and tumor stage. Prevention is very important. What are the preventive measures? Please seek the shade, especially between 10 a.m. and 4 p.m. Do not burn. Avoid tanning and UV tanning booths. Use broad spectrum sunscreen with SPF of 15 or higher every day. For extended outdoor activity, use a water-resistant broad spectrum sunscreen with an SPF of 30 or higher. Please keep your newborns out of the sun. Sunscreens should be used on babies over the age of 6 months. Examine your skin head to toe every month. See your physician every year for professional skin exam.